Hello, my name is Sydney Sellers, and I am currently a fourth year social work student at the University of Cincinnati. I did my capstone and research over the impact of trauma informed care on children and how certain trainings can impact the outcome of the mental health of children and the relationship dynamic between providers and clients. The research question that I wanted to be answered was, how does trauma-informed care trainings impact the outcome of client-provider relationships, with an emphasis on youth involved in trauma due to where I was placed at my field placement this year and which is where I conducted all of my research. When researching previous studies done, there was very few studies that were evaluating the process and treatment that comes along with trauma-informed care, including how to work with children in trauma, which was even less researched than adults. There are agencies and organizations across the country that have been implementing trauma-informed care into practice, but very few studies have evaluated the outcomes and if they improve the outcomes for youth. There has been a growing need for organizations and agencies to deliver trauma-informed care in order to offer safe treatments, avoid retraumatization, and reduce the effects of trauma. This was all researched in a study done by Bendel et al. Organizations and agencies have begun to realize how complex and everlasting trauma can be, and if not properly treated, can lead to negative mental health consequences and poor coping mechanisms, which will impact the child's well-being. There is no denying that trauma impacts everyone. There is no specific age, gender, race, etc. My research mainly covered children, ranging from the ages of 6 to 18. There is a specific need for providers to understand children who are experiencing trauma firsthand and how to treat them properly. Children and youth present trauma differently than adults will. They may display symptoms of withdrawing from activities, hypervigilance, or acting out behaviors. It is important for social workers to be able to identify and help treat clients who have experienced trauma without running the risk of re-traumatizing them. The methods of trauma-informed care provide a safe pathway to do these things. The design of this research is from a mixed method approach. At the current placement I am at, every provider must go through a training, which is a 2-day in-person meeting, where an outside professional from the Sanctuary Institute comes in and provides in-depth trauma-responsive training model called the Sanctuary Model, which is a blueprint for change that promotes safety and recovery from adversity through the active creation of a trauma-informed community. The Sanctuary Model has been effective and enabled agencies to work more effectively and therapeutically with your traumatized clients and improve treatment outcomes and increase employee retention and staff morale. In order to gain a better understanding of how well these trainings impact the children and families receiving services from this placement, the research design was set up with direct observations of how the providers interact with the children. While observing, I went through a checklist that included the 5 proponents of trauma-informed care over the course of a few sessions, which included safety, trust, choice, collaboration, and empowerment. This created a foundation of understanding if the client's needs were being met and if they were having a reliable and open relationship with their provider. At the start of each intake, an assessment called the PHQ-9 test is administered, which is rating their mental health on a scale. After several sessions, it will be administered again to see how well the trauma-informed care has been impacting the clients. I wanted to include learning outcomes and limitations on the same slide because I do feel like they go hand in hand a lot of the times. Of the 7 participants that I had been working with, 5 did have a reduced PHQ-9 score rating after receiving proper trauma-informed care after a few sessions with their targeted case manager and a few therapist sessions that I observed. Proper training for providers can increase the relationship dynamic between their clients and themselves, which is what my hypothesis mainly stated, so it was cool to see my research support my hypothesis. Some of the limitations were I only worked with clients who were mainly experiencing anxiety and depression caused by their trauma, so I didn't get to see the whole spectrum of mental illness and several behavioral disorders that can be caused by trauma. I was also mainly observing targeted case managers throughout the sessions and using the checklist. I did get to sit in on a few therapy sessions, which was a lot more in-depth about the client's trauma, which would have been a little bit more beneficial. And the PHQ-9 scale only rates depression and anxiety. So once again, I'm not getting the full spectrum of all mental illnesses and behavioral problems that can stem from a child experiencing trauma. Thank you for viewing my presentation, and that was my research on the impact of trauma-informed care on children.